Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today. You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Paladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. Welcome back, everyone, to the Tongue Tie Experts podcast. I am Lisa Paladino, and I'm very excited to have Renata Nehme with me today. Renata is the founder of the Airway Circle. Renata has been a registered dental hygienist since 2010. She has her associate's degree from Armstrong Atlantic State University in Savannah, Georgia, and her bachelor's of science degree in dental hygiene from Georgia Highlands University. The initials after her name are ones I want her to explain because we may not all know what they mean: RDH, BSDH, and COM. So while taking a continuing education class in 2016, Renata was introduced to the world of myofunctional therapy and immediately knew that that was her calling. She was excited to learn that the tenets of myofunctional therapy encapsulate many of her passions, which include breastfeeding, the import of early childhood development, and airway health. Growing up as a mouth breather, and we'll talk about that, Renata personally experienced the challenges that those with myofunctional disorders often face. That's why she's so passionate about spreading the knowledge she has acquired regarding airway-related health issues over the years. And that passion comes out, Renata. Thank you so much for being with us. And, instead of me reading about Airway Circle, I really want to delve into that today because that's how I found you. And I so admire what you're doing with the networking aspect of Airway Circle. Also, what we have to do, often in the world of TOTS, we talk about connecting the dots. And today I want to connect the dots between my typical patient, which is a breastfeeding dyad or a baby, with how that gets to the patient that comes to you or professionals that have your degrees. So let's get started. Tell me about Airway Circle and how that came about.
Well, first of all, thank you so much, Lisa, for having me. I'm very excited to be here, and I'm so proud of this podcast. You are doing fantastic. It
Oh,
was
thank you.
much needed for us to have this conversation out there, and as you can tell, people are loving it. So, first of all, just thank you, and then let me explain the letters after my name. So, RDH is Registered Dental Hygienist. BSDH is the Bachelor's in Science in Dental Hygiene that allows you to teach. And then COM is Certified Orofacial Myologist. So
Mm-hmm.
there's no standardized training in myofunctional therapy, but there is this certification through the IAOM that you can do that's very, very difficult. You have to take a written exam and you have to show your some cases, and they have to watch you taking patients, do a clinical exam. For you to be able to be certified, you're required to have certain amount of hours of continuing education every so often.
So if you have the COM, it means you went to the
IAOM. So you've
IAOM.
taken a course through the
Right.
IAOM and you have been certified through the IAOM.
Okay.
It's
Which
just
I
a
know,
very,
that's very vigorous. I know, because
yes.
I've looked into that.
Yes, it took me a whole year
Yeah.
just to get a written exam done. I had a newborn at home, but it's a very well done and written program. So I'm very glad I went through it.
Yes.
And then, so I've been a myofunctional therapist since about 2016 when I, fell into this rabbit hole.
Mhm.
And you start taking courses, you start reading books, and then you start treating patients first, family and friends,
Mhm.
to kind of figure out exactly, what your program is going to be like and what you're doing. Um, and then more heavily in the past 3 years or so, that my company has kind of blown up
Mhm.
because more and more patients are getting interested in tongue ties and mouth breathing, and sleep. They want to feel better. They want to learn what else they can do. I feel like nowadays patients are being their own advocates. People are taking control out
I
of their
am.
health.
Mhm.
Yes. So they are starting to ask more questions instead of just accepting what physicians are telling them,
Mhm.
which is amazing. And it's just incredible how much more we can help our patients by, digging and looking at the root cause, what exactly might be causing these issues and what we can do to help them feel better.
Mhm. I love that you use the term root cause. On the other side of my practice, I'm a midwife, a women's health practitioner, and I have studied and practiced functional medicine. And functional medicine is finding the root cause and and
Mm-hmm.
and solving that, and asking why. We just have to keep asking why and why and why,
Yes.
and it goes along, it correlates so well with this field of and of all ages and stages of
Mm-hmm.
life, right? All the
Yes.
different anomalies that can be going on, and we just keep saying, yeah, but why? Yeah, but why? Yeah, but why?
Mm-hmm.
What else can we do instead of just medicating or putting band-aids on problems, right? Yeah, it's so
Definitely.
interesting. It's so
So
interesting.
you mentioned the patients that are coming to me at 4 or 5 years old. So
Hmm.
those are patients that were missed whenever they were babies for one reason or another. Either they were able to breastfeed just fine, had no issues, or they had breastfeeding issues and mom decided to, or sometimes you have no control over it.
Right, right.
The baby was bottle fed or formula fed. Um, and then maybe some feeding issues afterwards were ignored. Nowadays we feed our children mush all the
Right.
time. So we
Right.
blend their food. I mean, I was so proud to do that with my daughter, blending her food and mm, pouches,
Mhm.
baby food, mac and cheese, chicken fingers, and French fries. I mean, you no longer need teeth to eat.
Right. Isn't it?
So,
Isn't it something? And I think it started even back in my generation, because when I
mm-hmm.
think about, first of all, not to get personal, but it's all personal, right?
Yes.
I was bottle fed. My mother bragged about how far I would throw up which is terrible.
Wow.
She said I had a flat head and the doctor wanted me to sleep with a roll under my neck, right? So then you
Wow.
had plagiocephaly, right? I mean,
Yes.
like you look back and you can put all the pieces together, but sometimes when a family is in it and they don't have the proper guidance or they don't have anyone around them to support them and say, maybe it's this, babies compensate really well. And then we start
Exactly.
feeding them the foods that work for them. And I think
Mm-hmm.
that's what happens a
Exactly.
lot.
So
You
things
know?
just get missed,
Right.
as we're growing up, we don't really know as a parent, we don't really know what is normal, what is not, what to look for. We all hear that children can be picky eaters. We all hear that, um, some children just don't breastfeed, or some moms just run out of milk. I mean, we all hear these things,
Mm-hmm.
but whenever you're not a professional, it's made culturally, it's made as something very normal, so we just accept and we move on. So when children are getting to 4 or 5 years old, maybe some more issues then start coming out. Their speech is still not super clear.
Mm-hmm.
Then they start asking questions. They're going to school and now they have ADHD symptoms. They're super hyper. So then these things kind of start coming out around that age, and then parents start asking questions. The child is still wet in the bed. They're not sleeping well through the night. So those are the type of patients that are coming to me around that age.
Mm-hmm. So airway issues lead to behavior issues and obviously sleep issues, and not sleeping adds to more issues, and it's just a vicious cycle. And I do know that in the mainstream medical model, what we do then is just give medications for each of those problems. And that doesn't solve anything, and it often makes it worse, right?
It is so sad. I mean, all these children that are taking Miralax for chronic constipation. And yes, there are many reasons why somebody can be constipated out there. But let's look at everything. Let's look at this child's diet. Let's look at this child's water consumption. Let's look at this child's tongue. Maybe they're tongue tied. Let's look at their swallowing. Maybe they're not chewing their food enough.
Not even eating enough because they have such a struggle with eating. So how do families find you? Like, who refers to a myofunctional therapist?
I like to say the myofunctional therapists are the middle puzzle piece of a multidisciplinary team, because we have a little bit of knowledge in all of these different fields, because we need to be able to refer out. So when they find me, a lot of times through social media, I will look, and then I'll be able to either refer them to an occupational therapist if I see some issues with reflex integration or sensory issues, to a physical therapist if they need more body work. I refer to an orthodontist if they need help growing their jaws a little bit more. I refer to an ENT if I see issues with tonsils or maybe adenoids. Of course, I cannot see the adenoids. I refer to, an IBCLC if I don't see personally babies, but for a myofunctional therapist who sees babies, we would refer to an IBCLC if that baby is breastfeeding or bottle feeding. So we are the middle puzzle piece, but usually I have orthodontists, dentists that refer to me. Those are the main two. Because they see patients twice a year in the dental office for regular cleanings. And it is such a perfect place for you to screen these patients for airway issues. You can see what their tongue looks like. You can see what their palate looks like. You can see if they have tons of cavities. A lot of cavities can, come from mouth breathing. If they have a tongue tie, or I like to call it a tongue restriction, they cannot clean their teeth very well. That's going to allow more plaque to stay on their teeth and also increase the chances of cavities. So there's so much more. As soon as that patient walks back, how are they walking into the room? Are they walking on the tip of their toes? There's just so much that's related that we can start looking at. Do they have crowding at all in their teeth? Are they breathing through their mouth? Do they have a stuffy nose constantly? Are they extremely hyper in the dental chair, trying to touch everything? So In a dental office, just like
it's really fascinating to me how the dental office has become, for those dentists who are doing this right, such a holistic assessment. I mean, even for grown-ups on the other side of things, I know my own dentist, Dr. Victor Avis. I don't know if you've met Dr. Avis, and I can't wait to have him on. He starts with taking your blood pressure. Like I never had my blood pressure checked.
I did that.
Sometimes we go to the OB/GYN and they check your blood pressure, right? So here they are checking your blood pressure, asking you all the right questions, because on the other end of the spectrum is cardiac issues related to dental health on all aspects of dental health, right? What bacteria live in our mouths and all that.
Yes.
I digress. I love that, we have so many opportunities to address our health that get missed, as we were saying, earlier. And here is the biggest one of all, the dentist, who is becoming, in the right circles, the best or very important aspect of the healthcare team.
You're absolutely right, in the right circles. And we created this Airway Circle now since you brought it up.
That's a great segue. So let's talk about Airway Circle, because I don't know, I feel like it's everywhere doing everything. Every time I look up, I'm like, oh, Airway Circle's got this going on. They're doing this course. They have this podcast, and I love it. I love it. But tell our listeners, especially for the professionals, because it's more of a professional program, right?
It is a little bit of both, mainly for professionals, but the whole point of us creating Airway Circle, it's because all of these patients need the help. They want the help, but they don't know where to go to. So I thought one day, my goodness, we need to have a directory that encompasses all of these different courses that are out there, all these different associations that are out there. So people know that if they choose somebody from that directory, they know they're going to look at the root cause. They know they're going to be well taken care of, and they're going to try to do everything preventively before they recommend surgery or medication. So I started reaching out to the community and created, a Facebook group, and we started doing clubhouse meetings, because you have to be able to share what you know. The second that I learn something new and I keep it to myself, I don't help anybody else. The second that I share that, I'm actually helping myself also.
And you know what? The important thing that I think gets missed in medical, dental, every kind of education is the interdisciplinary sharing.
Yes.
Right? Because we learn in silos. I say this all the time when I'm talking about my own professional course. Most of the time, we learn in our own silos, and we don't learn each other's languages, and we don't learn how to talk to each other. So that's one of the beautiful aspects of the Airway Circle that you've created. It's all
Thank you. And yes, I mean, being able to hear from all of these amazing professionals from all over the world about exactly what they do, what they are looking at, it has helped me become a better clinician, because now that I'm looking at my patient, I might notice something that I didn't see before, because we all say this, you only see what you know.
Did you learn about tongue tie in school? I know I didn't. Do you want to have more confidence with the breastfeeding infants that come to your practice? So many of the students of the Pro Guide to Tongue Tie are IBCLCs, CLCs, other lactation professionals, or speech-language pathologists who are looking to gain more knowledge of breastfeeding as it relates to babies with tongue tie. We are really excited when we have SLPs in the course, because most of the time SLPs and lactation professionals don't learn together. We also have anyone from a doula to midwives to nurses to physical therapists, occupational therapists. If you are a professional that either already works with breastfeeding families or would like to, think about joining the Professional's Guide to Tongue Tie in the Breastfeeding Infant. You can learn all about the signs and symptoms of tongue tie, how to assess for tongue tie in the breastfeeding infant, and you can learn my successful protocols. I've been doing this work for over 10 years, and I share it all in the Professional's Guide. If you would like to check it out, it's www.tonguetieexperts.net/professional course. The link is in the show notes. And as always, you can use the code podcast15 for 15% off. I almost forgot to share my favorite part. We have a community growing all around tongue tie and breastfeeding and all aspects of assessment and treatment of tongue tie. If you're a student of the course, you get admission into our group, and we have live events. We have a meetup coming next week on Zoom, of course, and we will be networking and collaborating and talking about cases. We'll be sharing research that we found. It's all about community. So if this sounds like something that you would be interested in, we'd love to have you. Again, it's tonguetieexperts.net/professional course, and use the code podcast15 to get 15% off. Hope to see you in the group.
The more you learn, the more you're going to be able to direct your patient to the right professional. So we have weekly webinars. They are free live. Airway Circle is huge about giving back. The whole point that we're doing this is to grow the field and to be able to help more patients. So we offer these weekly webinars, and it's on Thursdays nights at 8 p.m. Eastern time. And we go live on Zoom and then on Facebook. And then we also have a book club that meets every 2 months, and we have the authors come talk about the book. And we have a study club where we share cases only. That's monthly. But it's all from experience, all about exactly this is what the patient came up with. These were the issues, and this is what we did. These are the other professionals that were involved, and these are the results.
So this is what worked. This is what didn't work, so that we don't have to learn separately what works, right?
Exactly. And we're very big about sharing in that study club, things that we do with our patients, what has worked experience-wise. It's all about experience. And then we have a WhatsApp group that veered off from that study club that we talk over there almost daily, sharing cases and ideas with each other. It's just become this really tight-knit group that is extremely supportive. I really have not found anybody on Airway Circle yet that doesn't want to give as much as they are getting.
Right. That's beautiful. It's like everyone's checking their egos at the door and just being there for the mission that you've set.
Exactly.
And that's, that's a testament to how well you've set it up. And that's not easy. So, kudos.
Yes, I mean, I think it's one of those things that it was needed. We didn't know it was needed, but there was, this need for us to talk to each other. And I am so glad. I mean, I'm not doing any of this by myself. I have my Airway Circle girls that help me. They're all volunteers. All of us are volunteers, including myself. And we put so many hours into creating these meetings, and we have courses almost monthly.
And you have a membership, correct?
So we have
joined the membership. I'm so excited.
Yes, thank you for your support. I mean, we really appreciate everybody that wants to join us in our efforts. Like I was saying, it takes a lot of work and effort for us to put this together. But the more support we have, the more we're going to grow this field. Everybody's going to benefit, including patients.
And I want to just mention that there's not enough IBCLCs in the group. So if you're an IBCLC, please come and join Airway Circle, because more of us, so that the cases get more towards lactation, because we don't only want to be talking about older kids. We want to
you guys are the first ones. I mean, we talk so much about breastfeeding and how important it is. And I get messages daily of a patient saying, which IBCLC should I go to? What questions should I ask them exactly?
Right.
And, or they have seen, just like any other professional, they've seen a speech pathologist, they've seen all those other professionals, and nobody has ever mentioned a tongue tie.
Right.
We try to explain that it's not common knowledge in dental school, medical school, dental hygiene school. Nobody really explains that there are different types or different severities of restrictions. You have to take extra courses for these. And unless you have a personal, experience, if you have a child or a grandchild or somebody that might have these issues, that you go look for this information, most of the professionals are fine doing what they're doing, what they learned in school, and they're making enough money and they're busy enough. They don't really have to do anything else. So, that if you find somebody on Airway Circle, these are people that are putting the time to study more and to learn more and to always grow in their career, to be able to help their patients more.
Sometimes I excuse the professionals who don't know, like, well, they can't help it, they haven't learned about it in school. And then I think, and I go, but you know what? We didn't learn about it in school either.
Exactly.
Right? It's something about a curiosity to learn. And, I tell the story about I had 3 babies in 1 week in my office once that I couldn't help. And because I didn't know about tongue tie. This is going back like over 10 years ago. And, my preceptors didn't know about tongue tie, so I didn't learn about tongue tie in my IBCLC training. I have 3 medical degrees, 2 licenses to practice, and I knew very little, and I felt horrible. And then I found a group. At the time, there was going to be a conference, and I was like, I never even heard of this. How could there be a conference about this? And I went and I walked in, and it was like, I was like, wow, I found my people.
Wow.
Really, just like how you feel with Airway Circle now. It was one of the first tongue tie professional organizations, which has since evolved and broken up or whatever. But at the time, it was just amazing, and I met people there that I'm friends with to this day, and that we've learned together and grown together. So it's really I don't know if we should blame the people who don't know or not.
Not at all. They're not to blame. Like I said, I've been here to so many orthodontists' office, telling them, oh my goodness, we need to start getting these kids earlier. Let's start expanding. It's not about their teeth, it's about their breathing, because that's going to affect all the areas of their lives. And they look at me, they say, Renata, I've been doing this for 20 years. Why do I have to change? They're making enough money. They don't have any room to put any more patients. They're so busy. They're in their sense. I mean, there's no reason for them to spend so much money learning new things, adding new appliances that they haven't, used before. It's a lot. It is a lot. And I understand that.
And then taking that step back and saying, what I've been doing maybe hasn't been the right thing. It's really hard.
That is the hardest thing for you to actually accept that maybe you could have harmed some patients along the way. Nobody wants to admit that. I mean, I know I have, for lack of knowledge. Being a dental hygienist, I have missed so many patients that I could have helped better. These children that would come in with tons of plaque on their teeth, and I'm like, you're just not brushing. Well, no, they had a tongue tie and they couldn't clean. I mean, all day long, your tongue is moving around and cleaning your teeth. If you're constantly gathering so much plaque, there has to be something else, but anyways.
So you know what? Just because there might be parents listening who don't understand what we're saying about expanding, let's just do a simple explanation about traditional orthodontics makes the mouth look beautiful, but it doesn't solve the problems of, and maybe you can explain better, the problems of the way things are in your mouth.
Yeah. So in this airway field, we are looking at craniofacial development. What are things that could increase the chances of your upper jaw and your lower jaw, your whole face really, to grow to its full potential? So lack of breastfeeding is one thing that's going to, take you in the opposite direction. Not chewing hard foods is also going to prevent your face from growing better. and mouth breathing. So when you have a child, a small child, their teeth are supposed to be like a picket fence, a tooth and a whole space, a tooth and a big space. And when their teeth are touching and it's a beautiful smile, you know already at that point that that child's going to need braces because they don't have enough room. So we can go ahead and start growing those the jaws so they will have enough room for their teeth when they're older. Traditional orthodontics just wants to fit the teeth into the jaws that they have. So usually they will wait until this patient is about 12 years old. If they really are super crowded, have no room for their teeth, a lot of times they will extract 4 premolars, 2 on the top and 2 on the bottom. And then what they do, they push they push the front teeth back. All of a sudden, you just made the jaws smaller. But the teeth look beautiful and they fit beautifully. But now you have a tongue that does not fit to that space very well. And there are, things that could start happening if your tongue is too big for your jaws. It can start falling in the back of your throat whenever you're asleep, causing an obstruction, causing sleep issues because you're not breathing as well. It can cause swallowing issues. Your tongue is supposed to fully suction to the roof of your mouth and create a vacuum seal every time that you swallow. That could cause you to swallow air. I mean, there's so much that can go into it.
Plus, all of that leads to a high, narrow palate when you're making things narrow, which affects, because the top of the mouth is the bottom of the sinus cavity.
Yes.
So if we have any parents listening that have kids with chronic sinusitis or always having like black, dark circles under their eyes, they're not sleeping well, and they're a lot of sinus issues, it could be because they're breathing through their mouth instead of their nose because they can't breathe through their nose, right?
Exactly. All of those that you just mentioned are sign of the maxilla not being fully developed. So people that are in the airway field, they know to look at a child and say, there's something that we can do. Let's help those jaws grow. And what can you do? Promote nasal breathing, promote the tongue being up on the roof of the mouth, and more importantly, the back portion of the tongue being up on the roof of the mouth. Whatever you have to do to create that vacuum seal, that's where your tongue needs to be. And that's also going to promote jaw growth. The nasal breathing and the tongue position and chewing hard foods and all that is going to promote jaw growth. But some airway dentists and orthodontists will go ahead and start expanding those jaws. So they put devices on the roof of your mouth. Some are removable, some are not. And those will increase the size of the jaws a little bit faster. By age 8, 80% of your upper and lower jaw are fully formed.
Wow.
The lower, I think is even faster than that.
Orthodontist yet.
Exactly. So by the time they go to the orthodontist, they're pretty much fully formed. So, I mean, there's still things that they can do, but if you want to optimize what that child is going to look like, what the child, their breathing is going to be for the rest of their lives, we need to start early. We need to start looking at these things early. So starting with a myofunctional therapist is the best place you can start. That's a question that I get all the time. So I'll go ahead and mention that.
Yes, absolutely.
Because we refer to all these other patients, all these other professionals.
If you go to it, exactly who those people are.
If you go to an ENT first, it's very unlikely that they're going to say, maybe you should go see a myofunctional therapist.
Right.
If you go to an orthodontist first, a lot of times they're not going to refer out, but we will.
Right. Yeah. I get this question all the time. If I have a family come to my office and they're coming to me with their baby, but they have older children.
Yes.
And they'll say, you know what? I think my other child has a tongue tie, or I think I have a tongue tie. Who should I go to? And I always say, and we don't have enough of them where I live, you have to start with a myofunctional therapist. For some reason, everyone wants to start with someone with the doctor in front of their name.
Yes.
That's like a very big block to being able to refer to myofunctional therapists, because for me to try to explain to them that a myofunctional therapist will understand and be able to treat the child and tell you where to go
yes,
before the doctor, is kind of not always well received. I have to be honest, but
Yeah, it's not.
And I'm like, please don't go right. Don't go straight to him, because I know he'll do the release, and
exactly.
Don't do the release yet, because your child isn't ready for the release. That might not be the right time, and then you're hurting the baby or the child for no reason, and going through the trauma of it without having full function improved. Because as with baby tongue tie, it's not just about releasing the frenum. It's about letting the tongue learn to work in the new ways that it needs to work. And if we can get that happening before the release at any age, we'll have better results, right?
And addressing the whole body, because a tongue restriction, you're going to see consequences down your whole body, to your hips and to your feet, and the way that you walk and the way that all of it is related. So we have to address everything. It's very important. And even also emotional regulation. A lot of those kids are just not ready for that release. I mean, think about that word. It's a release. It's releasing so much. The fascia is so tight. And when you release that, it causes a lot of emotional things. So it's important for us to address it all.
Yes, I love that. I love mentioning that. I can't reveal who it is yet, but I have a guest that's going to be coming on when she's ready to tell about her tongue tie experience. And, I spoke to her before she went, and she thought she was ready. And it turns out that it was so much more than she expected, and things are bumpier. So that's why she hasn't come on yet. She's like, no, Lisa, I'm not ready to talk about it yet. So so stay tuned for that, everyone. I and it's somebody who's like pretty well known in the wellness space. So it's going to be really cool. I can't wait to have her on. Anyway, so Renata, is there anything else? Like, is there anything we haven't covered on today that you would like my audience to know about or to hear? Either about what you do as a myofunctional therapist or about Airway Circle at all?
If anybody listening that's looking for a professional, you can go to airwaycircle.com and click on directory, type your state, and just click enter. You're going to see many, many professionals around your state that you could reach out to if that's something that you need, or if you know somebody, please just share our directory. We have a podcast that we started that has 3 different shows. One is more for moms. The other ones are more for professionals. It's called Airway Circle Radio. And then I will touch on our membership really quickly for the professionals that are listening. We have 2 different options. One of them, it's $35 a month, and you get access to all of our webinars and some extra things. We have discounts. We have member highlights. We have a research folder. And then we also have the Golden Circle membership. The Golden Circle includes almost everything that Airway Circle has to offer, which are the weekly webinars, the study club, the book club, and our monthly courses. Every month or so, we have these extension Airway courses, and you pay 1 monthly fee and you have access to it all.
It's beautiful. Yeah. And I'm going to put the links in the show notes. So everybody can go to the show notes and click on the links and get the information they need. I love the directory. It's something I've been trying to do inside of my, course and inside the Facebook groups that I run. And for it to be successful, I know how difficult that is. So again, much admiration to you, because I'm trying to do that, and it's not easy.
It's a lot. It's a lot. And it's insane now, a year and a half later, how many messages I get weekly of professionals saying, thank you so much. Airway Circle just sent me a patient. Airway Circle just sent me a patient. So we're sending a lot of people
think
there.
Of all those patients that are being helped, and how many families are having improvements and better life cycles, better better quality of life for everyone in the family.
It's one of those things, we all have a purpose while we are here, but we always have to look at what are we doing for other people? What can we do today to improve somebody's life a little bit more? Sometimes it's, checking on a friend of yours, or saying hi to somebody, or calling, the cashier by their name. And in this field, everybody that goes into this field, we all are extremely passionate about helping people. So Thank you for everything that you were doing also.
Oh, thank you. That's beautiful. Yes, we all should do something every day to make the world a better place, right?
Yes.
Well, that's a beautiful place to end. And I just want to thank you. I completely enjoyed our conversation, and I know that our listeners will as well. And definitely, everyone who's listening, check out the show notes, check out Airway Circle, and stay tuned for more episodes like this. Thank you so much for listening.
Thank you.
Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. Tongue-tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue Tie Experts Insiders. It includes monthly online meetups with me, Lisa Paladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue-tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.